You know what I'd rather be talking about? I'd rather be talking about how hospital systems charge $30,000, $40,000 for a basic hernia repair, and how private practice doctors all across the country offer them for $3,000 and $4,000. And then I'd love to be talking to you today about why commercial carriers dislike is not a strong enough word for private practice physicians. They absolutely abhor them, they hate them. That's what I would like to talk with you about. Instead, we have to have conversations like the one we're going to have. Well, it's a one-way conversation, but you get the idea. You'll have it with your colleagues and friends. The idea is that hospital systems absolutely suck at everything. And the question is, why do they suck at everything? Well, we talked a little bit about it. We have certificate of need laws that made insurance companies and big-time hospital executives basically the owners of hospitals versus having physicians as owners and clinicians as owners of hospitals. I mean, can you imagine? Can you imagine? Imagine if you're a restaurant owner in New York City and you have to ask every other restaurant owner in New York City if you can please build a restaurant. That's how hospital businesses work in 35 states. The states that don't have those laws don't have the problems that New York's having right now. Hospital and health systems are totally foobarring everything. There's not enough equipment. They're making people work anyway. The doctors feel bad, so they're going to treat patients. What's going to happen when these doctors start falling dead? Nurses start falling dead. What's going to happen then? The health system's going to step in? What are they going to do to rectify that? Well, they're going to screw everything up just like they always have. So here's what I want to talk to you about today. Here's what's happening. Hospitals in states like New York are now requisitioning ventilators and masks from private practice offices where we do procedures for half of the price that the hospital does. They're taking that equipment and using it. And you know what? It's the right thing. But here is the trouble and here's the challenge. In about a month or a month and a half or whenever this thing reduces in panic and reduces in effect, and physicians want to go back to doing elective cases, what will happen? Do you think the hospitals and health systems will help private practice doctors? I think the insurance companies are going to say to the hospitals, hey, make sure you bring that equipment back. So you have a system that was completely unprepared, especially in New York State. And then you have people who were prepared because they're reliant on themselves. See, private practice doctors can't ask for government funds. They don't know the president. They don't know members of Congress. They don't know people in the Senate. They're just everyday entrepreneurs working to build a practice. The small private practice in the country has 6 doctors. They have no lobbyists, no representation. They're not the AMA, the American Medical Association, that purports to help physicians, which they don't, or the American Hospital Association, which works on behalf of pension funds, private equity, and the health system owners. Not physicians, not in the interest of healthcare itself. So what's going to happen? What's happening now is we're treating COVID-19 patients, but there are 3.5, 4, maybe 4.5 million elective surgeries stacked up. And private practice doctors can't do those cases. Their necks have been stepped on like this. And this is why we dislike the federal government so much. And state government too. Just all government in general, right? It has its place. But what's happening is tsunami number 1 is COVID-19, and tsunami number 2 is going to be the absolute decimation of private practices. Private practices all across the country are furloughing their nurses. So what are they going to do for jobs? Well, it's not that we can't do the cases. We were well prepared. We had the masks. We had the ventilators. We paid our bills. We did the right thing. It's hospitals and health systems run by insurance companies and pension funds and private equity that have absolutely screwed this thing over. And the American voter allowed it to happen. That's the worst part of it all. So what are we going to do to rectify it? We need to make sure that every single employer in the country that has a self-funded plan is sending their patients to private practice, physician-owned facilities across the country. There's only 6,000 of them across the country. So it's not like you're lacking a place. I don't care where you live. If you live in Jackson, if you live in wherever a hole in the wall is around you, there are plenty of physician-owned facilities. If you live in densely populated areas, there are physician-owned facilities. In fact, it's better for your health to go to a physician-owned facility. You know what the readmission rate is in a hospital? 10% or higher. You know what infection rate is? 3.5% or higher. No, correction, 3.1% or higher. That's in the good ones. The bad ones? 7%, 8%? That's not good. You know what it is in a private practice owned center? Less than 1. If you're healthy, you don't go to the hospital. Don't let the hospitals and the health systems win. They've done nothing but raise prices year over year. They've done nothing but try to make it illegal for private practices to exist. They work really hard on the Hill, and your politicians, and I don't care who you are or what you believe, your politician that you voted for listens to the American Hospital Association when they try to put physicians out of business. Pension funds, insurance companies, private equity want physicians, nurses, clinicians under their thumb so they can control everything. That is the strategy. You, the American voter, the person, the doctor, whoever you might be, need to get aware, you need to get some urgency in you, and you need to make sure that when you're doing a medical treatment, you're doing it with a private practice, physician or nurse. Rojas out, stay safe.